Schizophrenia, Nature and Nurture. During the course of this semester, our group has dedicated our time to researching schizophrenia and how it develops. A common question that has been puzzling scientists for years is, does schizophrenia originate from nature or nurture? It has only been recently that they have hypothesized that it may be caused by a combination of the two. In this presentation, we will be focusing on A, what is schizophrenia? B, how does schizophrenia develop? And C, how can we treat schizophrenia? Schizophrenia is a disorder that affects one's ability to determine reality from fantasy. It often includes delusions, hallucinations, and misunderstanding of social situations. Also, when referring to nature, we are talking about a person's genetics, and when referring to nurture, we are talking about the environmental experiences people are surrounded by. The correlation of the two is believed to enhance the probability of schizophrenia developing. When discussing treatment, we will be talking about the different antipsychotic drugs and psychosocial treatment that is available.
So what is schizophrenia? According to the National Institute of Mental Health, schizophrenia is a chronic, severe, and disabling brain disorder that has affected people throughout history. Scientists have found that every patient with schizophrenia is unique. Knowing this, medical professionals have been able to divide those who suffer from schizophrenia into 5 subtypes. Anjali Khan and J.P. Lindenmayer, who wrote a book on schizophrenia entitled The Textbook of Schizophrenia, explain that these subtypes include paranoid, disorganized, undifferentiated, residual, and catatonic schizophrenia. The 5 subtypes: paranoid, which is primarily marked by delusions of persecution and auditory hallucinations; disorganized, which is described by disorganized speech and maladaptive behavior; undifferentiated incorporates a combination of symptoms from other subtypes; residual includes a lack of motivation and interest in day-to-day living; catatonic involves experience of motor disturbances, which can be anything from immobility to excessive meaningless activity. Common symptom of schizophrenia: delusions. In addition to understanding the different types of schizophrenia, it is important to note the different types of delusions that people with schizophrenia often experience. According to Barbara O'Farrell, a writer who specializes in mental health's interpretation of scientific research done on schizophrenia, there are six different types of common delusions among those who suffer from schizophrenia. 6 common types of delusions. Persecutory, cause patients to believe someone or something is targeting them. Referential, cause the patient to believe that someone's gestures or comments are directed at that patient in particular. Grandiose, cause the individual to believe that they are of some extreme importance. Religious are often based around God or the belief that oneself has a particularly special relationship with God or another religious figure, and that God has given them special treatment in some way. Somatic, delusions revolve around the belief that an individual has some sort of bizarre physical ailment. Control, cause the patient to believe that their own thoughts and emotions have been taken over by an outside force. There is a general sense of fear and constant paranoia that comes with having schizophrenia, and much of this comes from the delusions experience. The inability to separate reality from fantasy causes a major fracture in a person who suffers from schizophrenia's life. Diagnosis of schizophrenia. According to Christian Nordquist, CEO at Medical News Today, doctors use psychological evaluation, blood tests, and imaging studies to diagnose schizophrenia.
Nature and schizophrenia. As previously stated, nature represents the genetic causes of schizophrenia. In this case, genetics are represented by the genetic relationship between family members with schizophrenia. Another key aspect of nature as the cause of schizophrenia is the idea of genetic mutations and deletions. The genetic causes of schizophrenia are shown when analyzing the risk of schizophrenia between identical twins. According to research done by Ming Sung, who works for the Department of Psychiatry at the Massachusetts Health Center, an identical twin of a patient with schizophrenia and a child with 2 schizophrenic parents have the highest risks. So basically, the closer the familial relation between someone with schizophrenia and another individual, the more genetically vulnerable the individual is to schizophrenia. This table shows the increasing risk for schizophrenia as familial relationships increase. Notice how the highest risk is between monozygotic twins, the closest possible familial and genetic relationship. Research also shows that schizophrenia could be caused by the alterations and deletions of certain chromosomes. This is a picture that breaks down what a deletion kind of looks like. As you can see, the original chromosome loses a piece. According to psychiatrist Kenneth S. Kendler, victims of chromosomal deletion syndrome 22q-DS have high chances of mental illness, including schizophrenia. Another form of deletion is chromosome 22q11.2 deletion. About 25 to 30% of victims of this chromosomal deletion have a mental illness, including schizophrenia.
Nurture as a cause of schizophrenia. Recently, scientists have suggested a new theory that schizophrenia might be caused from nature and nurture combined. Tracy Peterson, a professional science writer, explains this in her article, Both Nature and Nurture Increase Risk for Schizophrenia. This means that someone who holds a depleted or altered gene and has experienced a traumatic event are more likely to develop schizophrenia. Julio Ming and Hongjong Song are neuroscientists who tested the hypothesis by changing the balances of chemicals in mice's brains to match as closely as possible to the brains of humans who suffer with schizophrenia. They wanted to see if putting stress on the mice and changing their makeup would resemble any kind of similar results as it does for humans. The test revealed that someone with a traumatic experience and an altered gene could make them 1.4 times more likely to develop schizophrenia than a person without both. These findings showed that when altering chemicals in the brains of rodents to match the makeup of someone with schizophrenia, the mind alters and acts more frantically. These type of symptoms are commonly associated with schizophrenia and gave the researchers evidence that stress from the environment and DNA play an effect on the development. Learning how schizophrenia develops, or how nature and nurture correlate, is important because it will only allow scientists to find new treatments for schizophrenia.
How do doctors treat schizophrenia? Upon being diagnosed with schizophrenia, the treatment varies depending on the individual's specific schizophrenic subtype and the symptoms that the individual experiences. According to the National Institute of Mental Health, because the cause of schizophrenia is not definite, treatments such as antipsychotic drugs and psychosocial treatments focus on eliminating the symptoms rather than curing the illness. Antipsychotic drugs. Some prevalent antipsychotic drugs include Abilify and Invega, which are frequently advertised on television. These drugs are usually given in pill or liquid form, and in order to avoid various side effects and relapse, upon direction by their doctor to stop taking these drugs, patients are cautioned to taper off the drug slowly. Psychosocial treatments. In addition to the use of antipsychotic drugs, psychosocial treatments are also used in order to treat schizophrenia. This type of treatment is designed for patients who are already stabilized and may be on antipsychotic drugs. Psychosocial treatments, such as group or individual therapy, can help patients deal with the everyday struggles of their illness, such as self-care, work, and forming and maintaining relationships. Other examples of treatments include rehabilitation, self-help groups, family education, and cognitive behavioral therapy. Most doctors use a combination of both antipsychotic drugs and psychosocial treatment to treat those who suffer from schizophrenia.
To sum up our presentation, we would like to review our three main questions. Question A was, what is schizophrenia? The answer is that schizophrenia is a long-term mental disorder that affects an individual's ability to separate reality from fantasy, participate in daily activities, and act normal in social settings. Question B asks, how does schizophrenia develop? Scientists hypothesize that schizophrenia develops from a correlation of nature and nurture. And question C is, how do doctors treat schizophrenia? The answer is antipsychotic drugs and psychosocial therapy. We thank you for watching our presentation and hope you learned a little more about schizophrenia, nature, and nurture.